Then if you said to me, okay, so what's the one thing we should be focusing on if we care about getting it right in these early years of life? The active ingredient, so to speak, is what we call a child's engagement in serve and return. Like in tennis, you serve that ball and your partner volleys it back and you're going back and forth, back and forth. That back and forth engagement that children have with loving, nurturing, responsive adults in their environment is what drives development forward. In fact, it's the only thing that drives development forward. There is no toy, there is no DVD series, there is no app that will actually replace these things on their own. When there is some positive effect from those things in young children, it's because there's an adult reviewing it with that child. It's actually the adult doing the work, not the app doing it to the child. As one of my colleagues says, there is no app to replace your lab. The thing is that when we tell people to talk, read, sing, play with their child, we're spanning an information gap, right? If they don't know that, let's put up a billboard, let's give them a pamphlet, let's run an ad on TV. And that's fine. Maybe they don't know that, and now they know. But the second part, the skills gap, how do I do that well, is much more challenging. And if you've grown up in environments where you don't see people interacting with young children, how would you know how to do that well, right? We may know how to do that because it happened around us and we just automatically assimilated it from our environment. But if you don't have those examples, it would be like asking a medical student to just say, go take out someone's appendix. What do you mean you don't know how to do that, right? That would be crazy, right? That would be ridiculous for us to do something like that. We need to reduce the emotional and behavioral barriers to learning. There's some amazing intellects that we see in these kids, and what's happening is that there's too many issues layered on top of that, so those intellects don't have a chance to flourish and benefit us all. Okay, so we all lose out when this doesn't happen well. We need to recognize that parents are the single biggest influence on children, so we need to transform the lives of children by transforming the lives of their parents, because that's how they'll thrive at home. And then, of course, health and well-being is not just health care, but really all of us. The Population Health Institute here at UW-Madison points out that of the health factors that go into health outcomes, 30% come from health behaviors, 40% from social and economic factors, 10% from the physical environment, and only 20% from the healthcare system. So we need to recognize that health and well-being is not just about health care, it's about all these factors together.